What's up? My name's Olivia and this is my channel, Her Holistic Path, where I mainly talk about birth and motherhood. Now, a few weeks back, I was scrolling through my YouTube feed and I saw a video pop up of a labor and delivery vlog of a surrogate mom. I watched it for a couple minutes and I was like, I don't feel like watching the rest of this. And I clicked out of the video. A few weeks after that, a friend of mine who is also a doula posted this same video to her Facebook, commenting about how it was kind of hard to watch and it was some things happening in the video that weren't really good as it pertains to birth. So I was like, okay, let me rewind and watch this video all the way through. And after I did, I was like, I agree, there are a few problematic things happening in this video. When I see the videos being posted to social media and shared and viewed by so many people, it becomes normalized, the things that we see. And that for me, both as a doula and a mother and someone who's passionate about childbirth education, is incredibly frustrating when we ourselves as patients and consumers are perpetuating and normalizing things that are happening in birth that should not be happening, and we're doing it without even knowing that we're doing it. So I guess as a doula, I'm going to do my due diligence and make a reaction video to this person's labor and delivery vlog, and hopefully the people who watch that video might watch this one and see that there are some things that happened that were not so good. So I skipped through to about the 15-minute mark because that's when things get a little hanky-panky, and I'm gonna just start it there.
In like a couple minutes.
Really? Oh, that's so What? Wow, that was
okay. She's complete +2.
Okay, so at this point in the video, she is starting to ask to push, and she said that this is an unmedicated birth and that she went from 3.5 centimeters to 10 centimeters in 15 minutes, which sounds crazy, but it happens to a lot of people. But what gets me about this whole situation, and I've watched this video through already, so I already know what's gonna happen. What gets me though is that this woman was already admitted in the hospital. She's already hooked up to the electronic fetal monitoring. She's in the bed. She's got the hospital robe on. It should not be a surprise that she is about to have a baby. Like, this is what we came here to do. And yet when it's time for the baby to come out and her body is ready to expel the baby, it's like, oh my goodness, like nobody's ready. It's like, well, but this is why we came here. We came here to have a baby. And I've been in precarious situations like this before, when a mother, she goes through her labor really quickly and no one is ready and the doctor is not present, and now it's up to the mother to keep her baby inside of her, and that is just absolutely ridiculous. But I digress. Let's keep going.
I need to push, I need to push, I need to push, I need to push. Can I push?
No, don't push yet.
It's fine. Don't.
You're doing good. No, you can't.
You have to wait. That baby
So
needs to
she's
wait.
obviously,
Hold on, her.
she's obviously really wanting to push.
Hold on, just breathe.
Yes.
Just breathe.
Wait, are the parents on the way?
Okay,
They're on the
so
way.
pause again. So like, she's asked like 4 or 5 times at this point. She said that she needs to push. She says, like, she's asking, can I push? When can I push? And at this point, it just starts to be, it just starts to show you how much of this medical system is built for the system and the benefit of the system itself, and not necessarily for the benefit of the mother. Because at this point, we're getting into a zone where it's just downright dangerous. When you have a muscle that is so large and so powerful and so strong, and it is putting its entire energy force into pushing a baby out of your body, and you as the birthing person are physically trying to stop that process, it's just not healthy. You're messing with the flow of the birth itself. You're getting in the way of what your body is trying to do, and you're creating more pain. When you put the tension of such a strong muscle up against the tension of you trying to hold that baby in, that creates pain. That tension on top of tension creates pain, and that's kind of what we don't want in birth. But it just shows you the hierarchy of who's more important, the birthing person or the doctor. And a lot of people don't understand that some of these rules and protocols and routines, such as you're not allowed to push your baby out until the doctor is present, it all boils down to legality. It's not about safety. In most cases, it's because if a nurse catches a baby and something goes wrong, you've got a legal issue on your hand. If a baby comes out and there's something wrong and they didn't receive medical attention in time, you've got a legal issue on your hand. So really, the doctor needs to be present just in order to avoid legal issues. It's not even because it's going to make it somewhat safer. Like, obviously, this is seemingly a low risk pregnancy. There's no other complications going on here. There's honestly no reason for her to not catch her own baby, but that's just my opinion.
They might miss it though.
Oh my god.
It's okay.
Oh my god.
It's okay.
Oh my god. Oh my god.
It's fine.
Hey.
Oh my god.
Right.
Oh my god.
You're doing
When
good.
can I push?
They'll tell you.
It's hanging off the side.
They're just getting set up. They're getting set up.
I know,
She's about
but
to
I
roll
need to
right
hold
off of
it.
this baby.
Do you want the baby on your skin, or do you want us to put the baby in the warmer after he's born?
She's literally like on the edge of this bed. She might as well have just stood up.
When can I push?
She might as well just stood up and squatted that baby out.
Trying to get her here, like in the next minute.
And I want to take a second because she keeps saying she needs to push. And a lot of people, when you're having an unmedicated birth and you get to that intense part of labor where it is like your whole entire body is surging uncontrollably, it feels really good to push. It does not feel good to fight it or try to hold it or try to stop it. It feels the best. So many people, like, obviously I'm a doula, and so after people have their babies, a lot of people will say to me, it felt so good after going through all of that labor. It felt so good to push. Like, that sensation felt good. It felt like what my body wanted to do. And I'm like, good. That means you and your mind and your body and everything was in sync, working together, not working like against itself. And it's just sad that this person was not even allowed to go with the flow of her own body simply because the doctors were not ready. And another thing I want to point out is it's so frustrating because as a doula, my entire job is to focus on the birthing person. And I hear a lot of nurses say how, like, they get into L&D because they want to help moms. Like, they want to be there for moms, and they end up spending all this time punching all of this information into the computer, and they're not even really focused on the mother. And there have been times where I'm at a birth where I'm literally seeing the emotional, physical, mental signs of this person going into transition, which is like the last phase of birth, of labor, before you actually give birth. And so seeing these nurses, it's frustrating because it's like you spend the time in there with that patient and you're supposed to be there with that patient, but because they have to put all this information into the computer and they have to check on other patients, they can't even really fully be present enough to notice, oh, this person's vocalizations have gone from this volume to that volume, and this person is showing these physical signs of progressing in labor, and maybe she needs to be checked, and maybe we need to call a doctor soon. Like, all of that nuance of just being with the person who's in labor and noticing how they are progressing without even giving them a vaginal exam, you can collect enough information to tell you, oh, things are picking up and moving along. You can just tell by the way a birthing person sounds that they're about to have a baby, the way their attitude is, and the things that they're saying. And it's frustrating because as nurses are in there with these patients, they're not really able to be attentive enough to look and be like, oh, things are changing. And of course, this is not going to be every nurse. I'm sure there are nurses who have found a way to juggle both, you know, looking at the computer and doing all these things with other patients and being attentive. But I hear a lot of nurses complain about how all they had to put their attention to is this computer, and it draws the attention away from the actual patient.
I know.
I know, you're doing awesome.
You're doing really good, Harm.
You are.
Like, I literally
That was
feel like
quick.
I
I know, but you can't.
What can I do?
Grab a Chucks from the closet on the top shelf.
So they're calling for another doctor, and this is yet again another issue with the medical system. You have to have enough people to staff hospitals. And unfortunately, it seems like one of the issues that, you know, mothers run into when they're having their baby is people aren't ready. This very exact scenario, because they're in another delivery, they're with another patient, and it's like, we as a society, as this medical system, we need to figure out a way to do this better so that people are not sitting around waiting like on a conveyor belt for the doctor to show up. There needs to be some sort of a backup plan. And I truly, honestly don't understand why nurses, outside of the legality of it, I don't understand why nurses are not being taught how to catch a baby. Because in a low risk pregnancy, when a baby is being born, 9 times out of 10, there's nothing for you to do but to make sure that the baby doesn't hit the floor. For all intents and purposes, a birthing person, a mother, can catch their own baby. It's not complicated. Yeah, you have a few instances of shoulder dystocia that have to be dealt with. You may have instances where the baby needs to be resuscitated. But in most cases, in low risk pregnancy and low risk birth, you don't need a professional to just catch the baby. Anybody can literally catch the baby. That's what's so frustrating, is that this girl should not have to be fighting against her own body just because we're waiting for someone to come and put some gloves on and put some scrubs on and put that little shield on their face and boop, catch the baby. And they literally aren't doing anything that is, you need a degree for. I'm not saying that doctors aren't important, but at this point, you're doing more damage than good. And on top of that, this girl, now, it seems like she came out fine, unscathed, no, issues. But I know that there are some people who've been in this situation where they've been told not to push, and where physically a nurse is holding the baby inside of them and not letting the baby out. That's not what's happening in this video, but I know that has happened before. Plenty of times. And people actually get nerve damage. They get, essentially, their sexual life is completely ruined. They have pelvic floor damage. They have reproductive issues just because a doctor wasn't present to catch a baby. I'm gonna leave that rant where it is and keep going.
Push right now. I need to push. I need to push. I need to push. I need to push.
They're right
Grab
here,
it
hun.
out and throw it down here.
I need to push.
Hold on,
Open it
hun.
up.
Hold on, hold on.
I need to push. I can't. It's
It's
coming
totally
out.
normal to poop while you're in labor. And I don't know why women are so afraid of it. I was afraid of it, but now that I'm a doula, it's just like, it's not a big deal. Like, you're having a baby.
Okay.
Is the doctor in here?
We're calling another doctor because that doctor is
I need to push.
doing another delivery.
I need
You're doing
to.
great, honey. Hang in there.
You're good, Harm.
Okay.
She's gonna be here
Just
in
a
just
second.
a second.
I feel like I just shit it.
No, you didn't.
No, you didn't. You didn't.
I have
There's nothing there.
Belittle green here.
No, I swear.
Technically shot. No, I'm just kidding. I'm just kidding.
No,
No,
I
you're
swear to
fine.
God.
No, you didn't. You really didn't.
Can they please hurry, please?
They're
on their way.
Sorry, we
they're
paid
as fast as they can.
So thankful.
Baby said, I
I don't
am
even
ready.
see me on the monitor. Can you
That was
please guys
fast. We can talk about something else.
Yes, they are. All right, Dr. Grant's here. Okay. So she went from 3.5
It's just
to
so
15.
sad that we as a culture think it's normal to make someone fight against their own body while in labor. Like, we think that it's normal, we think that's okay, we accept it, we don't question it, and it's just so strange, this hierarchy that no one, a lot of people just accept it, and it's a-okay.
For baby in about 20 minutes. She's a surrogate and
I need to push.
Hold on, hun. She's almost ready. She's almost ready. She's.
And this is the safest place. That's what gets me, is that people are like, the safest place to have your baby is the hospital. And here we have a prime example of like, any much longer and that baby would have came out. And I don't know how many people watching this know about the fetal ejection reflex, but essentially it's basically when your body is working and doing its thing and it's not disturbed, and the hormones build up to a point where you don't really have to actively, consciously push. Your uterus is just like, okay, time for this baby to come out, and pushes the baby out really on its own and is kind of uncontrollable. That's a very short definition of the fetal ejection reflex. But any much longer, a few minutes more, and this girl probably would have experienced the fetal ejection reflex, and that baby would have came out either way, whether the doctor was there or not. And it's crazy how we consider the hospital to be the safest place, but it's like she almost, you know, had the baby without the doctor.
And your gloves on. Just wait. Just wait a second.
I can't help it.
Yes, you did.
Yes, you can.
Yes, you did. Breathe.
I can't.
Breathe, harm. Breathe.
I can't. I have to push. I have
Breathe.
to push.
She's right here. She got her gloves. She got it. She got her gloves.
I'm pushing.
She's
Don't,
here.
Harm, don't.
Can I push?
Breathe. Just breathe.
I'm bleeding.
Almost
Breathe.
there. We're almost ready.
10 seconds. 10 seconds. Come on, almost there.
I need to push. I need to push. Please just let me push.
When you want to, roll over onto your back.
And they tell her to get on her back. Now this is the worst part of the video. I can sympathize, right, with doctors that work in busy hospitals that are understaffed. That's not their fault, right? And I can also sympathize with the fact that if a nurse catches a baby, she's gonna get into big trouble, and that could be a huge issue for her, and people don't want to lose their jobs. I can sympathize with those two things. What I cannot sympathize with is that we are still in 2020 telling people to get on their backs in the lithotomy position to push their babies out. It is mind-boggling how many times I've been to births in hospitals, and OBGYNs and nurses are all saying, get on your back, put your legs up, and hold your breath. And I'm like, what world are we living in where we are still doing this? Are we stupid? Like, literally basic anatomy will tell you that when you put a person on their back, the pelvic outlet, the place where the baby is coming out of the pelvis, is at its narrowest point. Literally, it's at its smallest that it can be when you lay on your back. And when you are upright or leaning over, that is when it is at its widest. This is basic anatomy of the human bone structure. I literally have no idea how or who can still justify telling women to get on their backs. Not only that, but when you're on your back, you're working against gravity. When you're on your back, your contractions are more painful. When you're on your back, it is literally working against the position of the baby and what the baby is trying to do and the rotation of the baby. There are a few instances where someone should get on their back to push their baby out. Typically, 95% of the time, you should not be just routinely putting people on their back to push the baby out. I don't understand why we're still doing this. It doesn't make any sense anatomically. We have the research, we have the evidence to show that people who are upright or leaning over during birth, they can just push better, they feel better, there's less pain. The pelvic outlet is open. I literally don't know why we're still doing this. It is like, I feel like in 1,000 years, they're going to look back and they're going to be like, what the heck was wrong with them? What was they thinking? Like, they had iPhones, but they were still telling people to get on their backs to push. The only thing that I can think that justifies this is that it's routine. It's easier for the doctor to see. It's easier for cleanup because they can lay that little blue tarp thing out and all the blood just goes down in it, and versus them like having to run around the room and then there's blood all around the room. These are the only things that I can think of that actually make sense, but none of these reasons actually have anything to do with the safety or the comfort of the mother and the baby. And that is hugely problematic. And this is part of the reason why I'm even making this video in the first place, because I've seen so many birth vlogs, so many labor and delivery vlogs. I can't stomach them anymore, where at the end of it, the mom's on her back with her legs hiked up in stirrups. And if you truly don't understand how backwards that is, I will make a whole video about pushing. Just go down in the comments and say, let's talk about pushing, because I need to know. Because if you don't know, you need to know. This is absolutely ridiculous and absurd. I wish that I could keep on going, but y'all will probably click out of the video if I keep ranting about this. Ugh. And then the cherry on top is when they finally get her to her back and the doctor's there and they say, you can push now. As a doula, this is just so incredibly frustrating to watch because it shows you firsthand the power dynamics and who holds the power when it comes to birth, who's at the epicenter, who's on the pedestal, who's most important, who's calling the shots, and all of these things. Birth should be a collaborative effort with the mother and the baby and the partner in the middle and everyone else surrounding them, supporting them in the best way possible. But this has turned into a ladder where the doctor is up here and then it's the nurse and then it's the partner and then it's the mom and then it's the baby. And literally they're at the bottom of the totem pole, and it makes no logical sense. It only makes sense when you talk about dollars and cents. So literally she does like one push, the baby comes out, which means the baby was probably literally just sitting in the birth canal, just waiting, literally waiting to be born and trying to be born. But her mom, you know, the mama was just kind of holding the baby in. But that's not okay. I just want to recap and make it very clear that I'm not making this video to judge the surrogate mama in that video, the nurse in that video, or even the doctors. I'm specifically making this video to critique our medical system, our maternal health system at large, because it needs to change. There's no absolute reason that we have the evidence and research that tells us these practices are not okay. It's not okay to tell a woman when she's fully dilated and ready to push to not push. Like, she should be flowing with the rhythm and the surges of her body. And there's no reason that we should be still asking people to get on their backs. And there's no reason that we should be continuing to perpetuate the hierarchy of medical providers so that the mother is still at the bottom waiting on this conveyor belt for her person to come and say, okay, now you can push. None of this makes sense for 2020, and we really need to see a change. And hopefully the more that we can talk about this and generate conversation, we can change the culture, and the culture will then demand a change of the system. But until then, hopefully you learned something from this video. And if you did, definitely share it so other people can learn as well. And again, I just want to reiterate, this is not a judgment of that mom. That is a strong mom, because I don't think I would have been able to resist the urge to push for that long. And again, I just hope that this generates a healthy conversation about birth practices in 2020. If you like this video or learned something, make sure that you share it, and I'll see y'all in the next video. Peace.